Know your rights in healthcare during COVID-19 for disabled people, fat people, and transgender people. April 15th, 2020. Presenters, Disability Rights, Education and Defense Fund, Nobody is Disposable, Transgender Legal Defense and Education Fund. This webinar is captioned and ASL was provided during the live event. ASL begins at 13 minutes and 15 seconds in this recorded version. We apologize for the technical error. Hello, everyone. This is Susan Henderson from Disability Rights, Education and Defense Fund. And people are still joining, but I think to respect everybody's time today, we'll go ahead and get started. So thank you for joining us. I'm so honored to be a part of this community and to be with our presenters today. I just want to do a few housekeeping items. If you'd like to watch the closed captions at the bottom of your Zoom screen, there's a closed caption button. You can, if you click that, you should be able to see the captioning. There's also in the chat box, I put a link to the captioning page on. You can look on your browser. So check that out. We also, and thank you to Deanna Baker for captioning for us today. We also have ASL interpretation by Rick Owen, and you should be able to see him if you have your, if you're in matrix view and not just speaker view. So please make sure you're in matrix view so you can see Rick and see the ASL. We'll take questions and answers. We'll do questions at the end of the presentations. There's a Q&A box button down at the bottom of the screen also, and you can put your questions in there and we'll take them in order and we'll go through them just to make sure that we try to catch everybody's and we're not repetitive. Anyway, again, thank you so much for joining us for Know Your Rights during COVID-19 to accessing medical treatment. I'd like to introduce our panelists today, starting with Claudia Center. Claudia is the legal director at DREDF. That's the acronym for Disability Rights, Education and Defense Fund. Oh, by the way, I'm Susan Henderson again. I'm the executive director at DREDF. Well, Claudia has just recently joined the staff at DREDF at the end of February, before all of this happened. We have been working with her for decades. She's a well-known disability rights lawyer. She was formerly the senior staff attorney in the disability rights program at the National ACLU office. She litigates cases that increase civil rights and civil liberties for people with disabilities and represents the disability community in legislative, amicus, and appellate work. She was also the director and founder of the Disability Rights Clinic at Disability Rights Workers Clinic that was held at the Ed Roberts campus while she was at Legal Aid at Work. She's argued before the US Supreme Court in the US Airways versus Barnett case that confirmed a broad scope of reasonable accommodation for disabled employees. And I'm so happy to be able to be working with Claudia. And I can't believe I'm working with somebody who was argued at the Supreme Court. Sandra Solovey is a disabled attorney, author of Tipping the Scales of Justice, and co-editor of the FAT Studies Reader. She founded the FAT Legal Advocacy, Rights, and Education Project. And during her career, Sandra has been involved in numerous high-profile weight discrimination cases, whether the issue involved accommodations, medical bias, weight, employment, family law, or criminal defense. Sandra has always recognized weight discrimination as a civil rights matter that disproportionately impacts people of color. Brandy Senziak is a fat, legally blind disability and immigration attorney who supervises the legal department. Oops, sorry about that. Who supervises the legal department at, I just lost, sorry about that. who's at the Independent Living Resource Center, San Francisco. She's the lead attorney with the FAT Legal Advocacy Rights and Education Project and the supervising immigration attorney at the Homeless Advocacy Project. Brandy also has a background in criminal defense. David Brown is the legal director at Transgender Legal Defense and Education Fund. David is a longtime civil rights attorney who brings a lifetime of dedication and justice to and equity and over a decade's worth of litigation experience to TLDEF. David has led teams challenging state and federal restrictions on abortion and contraceptive access in state and federal courts throughout the nation, including the US Supreme Court. Another Supreme Court litigator, great. He's represented transgender and non-binary clients in groundbreaking civil rights litigation and participated in numerous asylum cases. And we have AC Dumlo, who's the program manager at TLDEF. They are a transgender, non-binary, first-generation Filipino-American activist. As program manager at TLDEF, they manage the Name Change Project, which connects transgender, gender non-conforming, non-binary people with lawyers providing pro bono representation during the legal name change process. Additionally, AC leads TLDF's community education initiatives and is the lead trainer for trans cultural competency presentations and workshops. So welcome to our panelists. We're gonna start off with a little background provided by Claudia Center. Then Claudia's gonna talk about DREDF's Know Your Rights to Healthcare, which we did with Disability Rights California and help from Brandy and Sandra, and we're thankful for the people who have translated it into different languages for us. Then after Claudia, Sandra, and Brandy will talk about Know Your FAT Rights, and then AC and David will go into Know Your Trans Rights. So anyway, Claudia, you want to get started?
Sure, thank you, Susan. My name is Claudia Center, and I just wanted to set the stage a little bit before we begin talking about the rights of our communities to healthcare and to equality in healthcare. And that is that we have a long history and present of discrimination in healthcare against people with disabilities, against fat people, against trans people, against Black, Brown, and Indigenous people, and so on. And of course, many people have multiple identities that layer these oppressions in accessing healthcare. So that's where we have been even before the COVID-19 crisis. So now we're in the situation where people with disabilities and other marginalized people are facing an even more egregious risk of healthcare discrimination. And in fact, those of you who follow the news, which is I guess all of us now, are seeing many policies being published and discussed that say that people with disabilities and people with pre-existing conditions should get a lower priority for life-saving treatment during COVID-19. And so that's sort of the context for why all of our organizations that are represented here and the collective, the Nobody is Disposable collective, all of us felt driven, I guess, to try to come up with some toolkits and some Know Your Rights information to disseminate as quickly as possible during the crisis. So that's kind of setting the stage for why we're all here today. The toolkit that DREDF put together is a very short summary of core rights that people with disabilities have under federal and state laws. In the toolkit I'm going to share is for California, but we have them for we have a one that's national on our website as well. And I'll just, I want to share the screen. Susan, do you think people need to pin the interpreter if they need the interpreter while I share the screen?
Yeah, yes, you can do both. You can make sure that that people can see speakers while the screen is shared by looking to by making sure they show up on the right-hand side of their screen.
Okay, so I'll share this tool, and then I'll pause a minute so that people can adjust their video as necessary. Oops. So this tool, we put it in plain language, or as plain as we could do in a very short period of time. And it's around 7th grade reading level. We could probably do better. But it is a short review of what the rights are of people with disabilities in accessing healthcare. And it summarizes the rights to non-discrimination and the rights to reasonable modification or reasonable accommodation. People use both terms. So under the ADA and the Rehabilitation Act, and there's a part of the Affordable Care Act as well called Section 1557. Under these laws, people with disabilities and people with pre-existing conditions have the right to access medical care, just like everyone else. And no one can deny somebody emergency care, like a ventilator, just because of disability. And I think that a lot of people think that because we're in a public health emergency, that somehow civil rights laws don't apply anymore. And that's not true. Even this administration, the Department of Health and Human Services, Federal Office of Civil Rights, published a document saying that the ADA and Section 504 and Section 1557 apply during the crisis. So even this administration has confirmed that. So that's an important right. Another important right is the right to reasonable accommodation. And we listed a few of these on our tool here. One is that you can bring a family member or other helper with you to the hospital if you need that person for your disability. A lot of hospitals are publishing no visitor policies, and we think that those policies need to be modified when needed for disability. Now, of course, if your family member or other helper is sick, then that would probably not be permitted, and that would be lawful. Because if something is very dangerous, it's called a direct threat, and then you're not entitled to it under the law. So if they're sick, you can't do that. You can bring a trained service animal with you most of the time. There may be some exceptions. You have the right to effective communication. So that means ASL interpreting, like we have today, CART. You can get paperwork in a digital file or in large print. You can get information in simple words. You can get information using pictures. There is a tool out now that we can share with the group called Communication First, which talks about all the ways to give people information. At least in California, you can for sure get information in another language. You can get an interpreter. You can get help and supports to connect to follow-up care and services for after you're discharged. And very important, you can bring your own devices with you, like a ventilator or a wheelchair. And those devices are yours. Those go with you. You cannot, legally, the hospital cannot confiscate those or take them away from you because that's part of you as a person with a disability. And that, of course, there's been a lot of fear around the rationing policies, the policies for who gets care if there is a time of scarcity. A lot of those policies have suggested or stated that ventilators will be reallocated or given to other people based on disability. And that's not permitted under the law. So one of the things we wanted to do with this tool is to make sure people are referred quickly to legal advocates. So we teamed up with Disability Rights California, who has a very robust legal team, and we have their 800 number on our tool. What I'm also doing, and this will be available by tomorrow, is that I'm developing, let's see if I can stop share here. I'm developing a longer tool that will have a lot of legal citations. And let me find share screen again. Oh, here it is. And this tool, it'll be about 6 pages and it will have footnotes. And I think people can use this fact sheet if they need to sort of have an argument with somebody and need to kind of have some citations to bring with them. So that tool will be available tomorrow. So again, we have this tool translated into Spanish, Chinese, Vietnamese, Korean. It's on our website, so it's available in a digital format. And so I'm going to stop talking right now and just see if Susan Henderson, my colleague, would like to say anything more about DREDF's tools.
Hi, everybody. This is Susan. No, so Claudia, if you want to pass it on to Sandra and Brandy, I think we're good to go.
I am delighted to pass the torch to Sandra and Brandy. Every single person who's attending today should, after the webinar, immediately go to nobodyisdisposable.org. It's just a wonderful, uplifting, empowering, powerful website that was put together by a coalition of people virtually overnight, and I just think it's great. So, Sandra, I think you're up.
Thank you so much, Claudia. The Nobody is Disposable campaign has several parts, including an open letter that we hope everyone who's joining us today will look at. We invite you to sign that. We have solidarity selfies to let people know what we think about what's happening, and also to offer support for people who are in the hospital now, to know that there are people thinking of them. And the Know Your Right toolkit is another piece. That's what we're going to be discussing today. But please do go to the website and check out everything. There's also a fat prepper's guide, so definitely good stuff to look at. This campaign came about because we were extremely concerned about the COVID-19 triage protocols that we were hearing about outside of the United States, and that we quickly then saw developing in the United States as well. The protocols discriminate based on disability and age, and we heard rumors about weight, and then we saw the fact that BMI is listed, BMI over 40 is listed by the CDC as a comorbidity. So we knew there was a very high likelihood that weight would become a vector for discrimination. Higher weight people face a lot of stigma and prejudice anytime we're in a healthcare setting, and that's magnified for fat people of color, members of the LGBTQIA communities, and people with disabilities. We became very worried about how that would play out in this kind of life or death situation, especially when there's not so much oversight because people can't come into the hospital and emergency rooms as they might normally. Because of this history, it is right to be concerned and prepared, but we also don't want to panic. So we have not heard of people in the United States being denied ventilators based on weight at this time. If you do hear that's happening, then please get in contact with us and with DREDF. To be completely clear, we believe such discrimination is unethical and unlawful as a form of disability discrimination. The fat community overlaps and intersects with all communities, including disability community. So there are people who are disabled and fat. There are people whose fat is itself a disabling condition, and people whose weight is the result of a disabling condition. There are also fat people who are not disabled, but may be perceived to be disabled, bringing them under the protection of disability laws, even though those fat people might not realize it. It's important to understand how racism and fat bias work together. So let's imagine every time that a fat person needs a ventilator, you say no, and you send them to the palliative care ward instead. Every time a thin person needs a ventilator, you send them to the ICU and you give them a ventilator. At the end of the day, if we look at that palliative care ward, we're going to see more Black people, as an example, especially Black women, in the palliative care ward who were denied their best chance of life saving measures. And this is compounded if you factor in other comorbidities, which are also not race neutral in their prevalence. So if you blanketly discriminate against fat people, you're creating this loophole where you're disproportionately impacting certain people of color. It's a double whammy of discrimination served up to a community that's already been experiencing systemic racism that limits access to healthcare, wealth, and resources. It is not acceptable. This toolkit is meant to provide information and considerations for higher weight, disabled, and older people, as well as people with certain medical conditions. If we have to go to the hospital during a time of scarcity, when discriminatory protocols are in place, we do have rights and there are people who care. So not everything in the toolkit is going to be useful for everyone, but please take what helps you, leave the rest. So now let's dive into that Know Your Rights content. We'll be scrolling through the Know Your Rights toolkit, which you can find at nobodysdisposable.org. I'm going to share my screen. Give me 1 second, please. Okay. So I'll scroll through this. And you can also go to view the website yourself, and I will pause and do a little description on the relevant descriptive images that are here. So I'm scrolling down through the toolkit and I'm pausing on what to do before needing to go to the hospital. There is a hand-drawn illustration of a stack of documents. The first one is labeled Power of Attorney. Before you go, there are a few things that you can do to preserve as much autonomy as possible. And the first one is about paperwork. So you can do a durable power of attorney for healthcare. That's a document that gives power to a person you choose to make medical decisions on your behalf and to advocate for you when you're unable to do so. The durable financial power of attorney is a document giving power to a person that you choose to make financial decisions on your behalf when you can't do so. The advance directive is a statement of your wishes regarding medical treatment. A will or trust controls where your property goes if you die. So many of us have had to fight for our rights and autonomy. And if we don't do these legal documents and do them correctly, then it's the government who's going to decide who makes these decisions for us. When we can't make them for ourselves, that is. So typically that would be a legal spouse, parent, or child. In many of our communities, that doesn't work so well. So for example, many of us rely more on aunties or cousins or chosen family or have non-traditional family structures. We may have cultural differences from our family. Maybe they don't understand our disability-related choices. Maybe they don't understand our gender or accept our orientation. You can love someone, but not feel like they're in the best position to make decisions for you. So the toolkit includes some things to think about when you're making these documents. I definitely invite everyone to look more closely at it when you get a chance. I'm scrolling down the toolkit now and pausing at the place to create a connection kit. There is a hand-drawn illustration of a fat person's arm with an ID bracelet holding a document in a sheet protector. The document has headings that say, about me, dear provider, and phone numbers. To help you stay connected to people outside and to help you connect with people inside the hospital, you can create a connection kit. You can use a Ziploc bag or a sheet protector and simply put a string in the corner of it. Inside that sheet protector or bag, you can include things like a photo of yourself, maybe with loved ones or maybe working, something that's humanizing, shows who you are. Phone numbers of your key people, a mini introduction to who you are as a person if you're not in a place where you're able to communicate that. We've also seen some medical staff at hospitals doing a really similar thing, which is very cool, where they're taping photos of themselves to the outside of their personal protective equipment so that patients can get a sense of who they are and see them as human beings. I'm scrolling now down to figuring out where to go. This section is called Where Higher Weight May Be Protected. There's an illustration that shows a map of the United States. One of the things that we suggest considering as a strategy is where there are existing laws that protect people based on weight. So when you're thinking about where to go, if you need to go to the hospital, you can consider what the law is in the different jurisdictions. You can consider your provider relationships. If there's a provider at that hospital that you know or people know you there, obviously where you have insurance coverage, if you have coverage. There are several locations in the United States where weight discrimination is specifically unlawful. If you're near one of those locations, you may want to go to a hospital there. I mean, just because there's a law doesn't mean that the hospital is going to actually follow it, but they really should. So let's say I live in Berkeley, California. Well, there's not a specific law prohibiting weight discrimination in Berkeley, California. So it's probably worth it for me personally. I probably would drive across the bridge and get treatment in San Francisco. In San Francisco, there's a law that prohibits weight discrimination. The toolkit here lists the locations that we know about where weight discrimination is unlawful in the United States. Certainly there may be more locations that we don't know about. So these are some places that have laws or rulings. And those places are Binghamton, New York, Madison, Wisconsin, San Francisco, California, Santa Cruz, California, Urbana, Illinois, Washington, DC, and the state of Washington has a ruling that's helpful. Michigan has a law that focuses on employment. So now I'm going to turn the talk over to Brandy. Brandy's going to tell us what to take, things to consider, and how to advocate one more at the hospital itself.
Thank you, Sandra. I'm going to continue going through our toolkit. As Sandra said, I'm going to start by talking things to consider taking, such as medications, a Sharpie or surgical marker, phones, chargers, and extra batteries, know your rights printouts, letters to providers, the connection kit that Sandra talked about earlier, and multiple copies of the signed power of attorney and healthcare directives. And communication tools, including assistive devices. Consider whether you want to bring your own breathing equipment, such as CPAP, BiPAP, APAP, or oxygen concentrator. If there is a shortage, the hospital may not be able to supply you with the needed equipment, so having your own could make a life or death difference. As Claudia was saying, we know that the community is very worried about reallocation of durable medical equipment. We have not heard of this happening yet. We have only heard rumors of this happening. But if this happens, please reach out to us and Redif. Potential survival strategies to consider. Build connections with your healthcare providers. Try to connect with your providers. To connect with all people that you come in contact with at the hospital. Providers that are providing you care may not actually be the same providers that are determining who receives the life-saving medical equipment. Humanize yourself. As Sandra is talking about the connection kit, show pictures of your family, and tell the provider something unique about yourself. With regard to rationing, tell them that you want the treatment options that provide the best chance of recovery, just like a non-disabled, younger, or thin patient would receive. You can use a Sharpie to write these instructions directly on your chest in case you become unable to communicate. Be sure that you do not accidentally write anything that conflicts with your choice in your advance directives. If there is a law against weight discrimination where you are, politely and confidently inform your provider about the law. Explain that you came there because you were worried about discrimination. Insist on your rights. If Sandra is going to San Francisco to receive care, the rights that she can expect will be posted in our chat and can also be found, or will also be able to be found on our nobodyisdisposable.org website. If there is no law against weight discrimination where you are, or your provider refuses to follow the law, argue, I know that you became a provider to help and heal people. I am asking for your help. I am protected by the Constitution. I am protected by federal anti-discrimination laws. You can also ask for an ethics consultation. If you do not like the results, ask to see what the appeal process is. There are other arguments that you can also make that are listed in our toolkit. You can also write a letter to a provider. People often have a hard time communicating with medical providers or knowing what to say. Our sample letters may give you some ideas of what to say, or you can even show them to providers if that works best for you. Please find our sample letters on our website in our toolkit at nobodyisdisposable.org. I will now turn it over to David and AC.
Thank you so much. I'm going to set up my screen here. Hi, everyone. This is, again, AC Dumlau from the Transgender Legal Defense and Education Fund. Thank you to our co-presenters for having us as part of this panel. David and I and Tilda are actually on the East Coast. And so we are waving to our friends on the West Coast. We are going to be talking about Know Your Rights for trans folks. Our guides are available at our website, which is tildef.org. And as you'll see on this slide, we have the image covers of our guides, which are called a Know Your Rights Guide for Transgender People Navigating COVID-19. This guide is in PDF format and available in both English and Spanish. The current version of the guide is updated through April 13th. And as we're talking about transgender individuals and communities, I quickly wanted to lay the groundwork in terms of shared vocabulary to make sure that we are all on the same page. So first, as we know, when a child is born and assigned a sex at birth, that is usually within the gender binary, male or female. So with that context, but also acknowledging that there are intersex folks, usually within this binary is how people are identified as children. So when we talk about transgender individuals, we break that down to the Latin prefix of trans. So you know the terms transatlantic, transcontinental, trans simply meaning across or on the opposite side of. So by definition, a transgender person is a person who does not identify with the sex/correlating gender of the sex assigned at birth. Within transgender people, there are transgender women, transgender men, as well as non-binary people. Non-binary people being people who do not identify strictly as male or female, such as myself, and are within the transgender umbrella. Cisgender people, cisgender comes from the prefix cis, which means on the same side as. So if you are not transgender or non-binary, you are not, you are cisgender. As an adjective, this is cisgender woman, cisgender man. And so to illustrate furthermore the transgender descriptor on this slide is a large umbrella with the text that says transgender on it. And under this umbrella are two smaller umbrellas. The first smaller umbrella says binary on it, and under this umbrella are trans women and trans men. And under the second umbrella is non-binary, and it says gender fluid, agender, genderqueer, and more. And so moving forward with the presentation, when I use the term transgender, I'm referring to people both within a binary and outside of a binary under this trans umbrella and of trans experience. With that context and vocabulary, as my co-presenters have emphasized, discrimination is illegal. And it is very real that trans people often avoid medical treatment out of fear of discrimination, such as misgendering, which means a person being called the wrong name, the wrong gender, or the wrong pronouns. But it really is critical that trans folks do not avoid testing and treatment if they are developing the emergency warning signs for COVID-19. And these are available online from trusted sources such as the CDC. We have federal protections, and while the federal government has been hostile towards trans communities, in fact, federal law does protect us, transgender people, such as under the Affordable Care Act, the ACA, and the Americans with Disabilities Act. In fact, prohibit transgender and non-binary discrimination in virtually all healthcare settings. In addition to federal law, your state, county, or city may also have laws that protect you. So you should know your rights. Having the right to be called your correct name and pronoun, to use facilities that are consistent with your identity. And reminder again, providers cannot refuse to treat you because you are trans or non-binary. If you are discriminated against, and this is awful and hard to speak up, but we really want to empower our trans siblings to know that advocating for yourself might not only address the problem you are experiencing, but also prevent future discrimination against others in our communities. And so what do you do? We have this kind of full list of what to do if you're discriminated against in the guide, but just to review it by bullet points, advocate for yourself, calmly and firmly telling the person who is discriminating against you that it is both wrong and unlawful for them to misgender you, use your wrong name, to treat you differently because of your gender. Report each incident to the appropriate staff, and if necessary, speak to a supervisor. Take notes. What's really important, document everything. The date, the time, the place, what happened, who was present. Continuing with that, obtaining names, not just of the perpetrators, but if there were any witnesses, including their contact information. Furthermore, save and obtain copies of anything that was written and documented, such as letters, emails, etc. And then finally, filing a complaint. So each agency enforces a different law or policy, and you can actually file with multiple agencies. Here we list the different complaint types that one might seek to file. A hospital or medical facility, through which often medical facilities have something called a patient advocate, who is charged with receiving and investigating complaints. You can also contact the hospital directly to find out how to file a complaint, as well as file a complaint with the Joint Commission. The Joint Commission is an association that accredits hospitals and prohibits discrimination against transgender and non-binary people. So doctors, nurses, and other health professionals, if you're filing a complaint there, you can file a complaint with the state's licensing board. The federal government, there is the U.S. Health and Human Services Department Office for Civil Rights. HIPAA complaints, this one is important. If your trans status or other private health information has been improperly shared by a medical provider or insurance company, you can file a complaint with the U.S. Department Health and Human Services Office for Civil Rights. And then finally, state and local non-discrimination laws. So these are going to vary by where you live, but it's really important to see what the laws are where you're living. Within our guide, we link to the Equality Tracker through a great organization called Equality Federation, which lists all of those. And to kind of close this out, I wanted to note a couple trans-specific areas that we want to alert people to their rights. In this time of social distancing, we've absolutely had folks in our communities ask questions about their prescriptions and medications, particularly hormone replacement therapy, also known as HRT. We want folks to make sure to reach out to their healthcare provider and or pharmacist. There are options for telehealth available, also the ability to prescribe medication for longer periods of time, really making sure that people do not have to put themselves in harm's way by going in person for medication. Transition-related surgery or gender-affirming surgery. This one, it is really unfortunate that non-essential surgeries are postponed, but we want to remind our trans communities that the surgery is postponed and not canceled. That being said, of course, this is incredibly taxing on folks' mental health. And within our guide in the appendix, we list a number of resources for mental health, including places like Trans Lifeline, which is a transgender-specific mental health hotline, as folks have to wait longer for these procedures that they've been waiting a long time for, and you know, causing more gender dysphoria for. And I just wanted to let you know that our guide covers actually more beyond healthcare. Our guide covers housing, employment, questions about the CARES Act and unemployment benefits and the stimulus payout, public benefits and applying for them. We also answer a few questions about identity documents at TILDEF. I run the Name Change Project, which connects low-income trans people with attorneys volunteering to assist with legal name changes, and so we address that as well. And of course, we know that having a person meet their basic needs is directly related to one's health, physical health and mental health. And so we at TILDEF are here to help provide that information. So again, you can download our guides at tildef.org. On this slide, I'm again showing the covers of our guide titled A Know Your Rights Guide for Transgender People Navigating COVID-19, available in both English and Spanish. These are accessible PDFs with image descriptions as well. And so thank you for letting us present. We are going to turn it over for questions and answers, and my colleague, Legal Director David Brown, will be joining me as well. Thank you so much.
Great, thank you all so much. This is Susan Henderson again. And in case you didn't catch it at the beginning, we're taking questions and answers through the Q&A function at the bottom of the Zoom screen. So I'll be going through the list of questions and reading them so our panelists can hear. And then whoever feels, if it's not directed to one of the panelists, I will open it up to them to decide who's going to respond. So I'm scrolling up to see some of the first questions right now. Here's one. I've read that hospitals refuse to allow people to bring their own ventilators and other equipment due to infection risk. Is this legal? So which one of you wants to take that question? Claudia?
This is Claudia. I think this would be a case-by-case basis. If there was an infectious risk, that could be taken into account. But then the person would need to be provided equipment that would replace the equipment that was not being permitted to come in. But we can, let me take that question back to the team at DREDF, and if you want to reach out to me individually, I'll try and give you a further answer on the infectious issue. I think that there are workarounds that should be able to work.
Okay. If it were to happen, so this is Susan again, and I assume this means rationing. If it were to happen and I didn't survive, would my family then have a right to sue the doctor or hospital?
That's a complicated, this is Claudia. The survivability, or whether claims, civil rights claims, survive a person's death is a big question. And it's even bigger in the context of COVID-19 when there's a public health emergency declaration by the federal government. I think the answer is maybe. Outside of a public health emergency, most courts hold that ADA claims do survive death, but the COVID-19 emergency puts, puts a wrinkle into things. And so I think the answer has to be maybe.
Great, thanks, Claudia. Another question. I think that I heard the answer to my question, but I want to double check. I'm nonverbal. I use an iPad to communicate. You said that my wheelchair wouldn't be taken away from me. Does that include my iPad?
This is Claudia. Yes, that would include any device that you use for your disability, medical or technology device.
Okay, here's another. Do you have any advice on how trans people can get hormones while sheltering in place? Since they are a controlled substance, people are required to go in, but this is not safe for many. How about David?
Hi, this is David. Yeah, I can answer that. So there's good news here. A lot of the rules that required individuals to go in for an in-person visit to a healthcare provider have been relaxed because of the emergency. So where previously you might have had to visit with your healthcare provider in person, it is now permissible to do it through telemedicine, through telehealth. So if you need an evaluation or a renewal of your prescription, you should go ahead and ask your provider, can this be done through telehealth? And if the person says no, you should also consider shopping around if you can for a provider who may be able to. There are, of course, certain circumstances. Oh, I should also say that applies to pharmacies as well. So if it's a question of just picking up your meds or speaking to a pharmacist, again, some of that can be done through telehealth, and the meds should be able to be delivered by mail. There are some things that there is no substitute for an in-person visit for, like a blood draw. So if you have to visit, for example, an endocrinologist and they have to get a blood sample, you should speak with your healthcare provider about how most safely to get your blood drawn and tested. There are a few circumstances like that where there may need to be some sort of in-person contact or some sort of workaround. There's no substitute for talking with your healthcare provider about how to address those specific situations where telehealth is not possible.
Thank you, David. So this one got answered in the chat, in the Q&A box by typing, but I thought I'd go ahead and put it out there verbally. I'm confused about how these federal protections that the speakers mentioned work in relation to the discriminatory care rationing policies in 25 states referenced in the Center for Public Integrity's article. So Claudia, you responded to that. You want to let everybody know the answer?
Sure. So these policies violate the ADA and Section 504 of the Rehabilitation Act and the Affordable Care Act. As I'm sure you are all aware, doctors and hospitals don't always acknowledge that they are regulated by our civil rights statutes and often operate as though they are not. And so the disability community has been fighting these policies by filing complaints with the Federal Department of Health and Human Services. They're the Office of Civil Rights for that agency, and by sending letters and by protesting and by just making a lot of noise and fighting those. And you will see that on social media, and you can be part of those fights, and so that's important.
Okay, here's another one. Does it make any difference if my BiPAP is the property of Kaiser? I don't own it.
Hi, it's Sandra. I can give some thoughts on that. So if you're talking about whether you should bring the BiPAP with you, if you were to go to the hospital, then there's definitely, it's not a simple decision. There's numerous considerations. So if it was me in that situation, I would be very alert to anything that might be happening with reclamation of equipment. And I would definitely factor that into my decision. But what I would be balancing is, even though usually you cannot bring your own equipment and use it, that if there's a shortage, there may be an exception that's made, and having your own equipment there could be make a life or death difference. So I think there's a lot of factors in the Know Your Rights toolkit. We talk about some of those different considerations.
Okay, thank you. Here's another one. I'm transgender and have a learning disability which affects my speech and don't have an advocate. How can I defend myself against medical discrimination?
So this is David. I can take a part of that answer, and then I wonder if maybe Claudia or you have a thought as well. So we often advise folks who have concerns about discrimination in a healthcare setting, right, to bring a person to help advocate for them. And right now, that's a bit of a challenge for a lot of trans folks because many hospitals are putting limits on what they call visitation, right? So you're not necessarily allowed to bring a person with you. So that's a case-by-case basis, depending on the hospital. Here in New York, I think that's become pretty common at this point. In other communities, it is not as common. And so one thing you can do is, if you're seeking care somewhere, get their current policy before you go. So you can contact them either over the web or by phone or email, and learn whether you can bring a person with you. If you can't, or if it's not appropriate to bring a person with you, like if it's not a person that you rely on to help you communicate, again, you can bring a piece of assistive technology, or you can maintain contact with the person who can assist you, by your phone, and you can explain to the providers that it's necessary for you to maintain communication with the person to support you, over the phone or by video. We usually recommend that folks bring a headset just to make sure that they can communicate separately with the care providers that are in the room and the support person through the device, because that avoids disruption to other patients' care and avoids miscommunication. But that can be a help to some people. And I guess, Susan, you had said you had something additional to say.
No, that wasn't me. Anyone else want to add to that, to David?
This is Sandra. I would like to add that if you're going to be relying on a telephone or a cell phone to communicate, to bring as many batteries as you can that are already charged, as well as a cell phone charger, to give yourself as many options to be able to continue using the device for as long as possible.
Okay, thank you. So here's a question. I don't do print. I prefer not to do wet signatures or deal with print in any way. I can't read it, I can't write it. I can't independently verify it without using extra technology that I don't always have access to. How do I make wishes known in a form the medical treatment people will have to accept? So for instance, can they put something in their medical records that will be accessed if they get admitted for treatment? Does anybody have a way to make sure that these wishes are known ahead of time? You can see that's a tough question. So maybe what we'll do, Sandra, go ahead.
I was actually going to ask Brandy if she had thoughts on that.
Yeah, so I mean, typically as you get admitted to a hospital, they do ask you those questions, but during these triage times and things, I don't know what their protocols are and what they're doing as far as asking people their directives. You can get assistance from some nonprofits ILRCSF, where I'm an attorney at, I can assist you with completing documents, and then they would need to be signed though, but some, signatures like an X or something like that would should be sufficient. But that's sort of, all I can think of at this time.
Thank you. Let's see. What can we do to prevent people from being moved to nursing homes under the 1135 waiver? Claudia?
This would be a question for my colleagues at DREDF, and I am happy to ask them offline and see what they say and give the answer back to you.
Yeah, so on some of these questions that we need to get back to you on, what we'll try to do, we'll be sending out a list of the resources to everybody who's participating and registered, and we will put where to contact everybody with those questions. And if we can, we'll answer some of those questions in that document also. I'm trying to see if there's...
Do you mind
Yes.
if I make a clarification?
No, go ahead.
We got a comment related to the recommendation, or not recommendation, but the consideration of choice of hospitals for folks who are worried about weight discrimination. And I mentioned, but I really wanted to reinforce that when you're considering whether to go to get your treatment in a place where there is a law protecting weight discrimination, if you happen to live near a place where that's a reasonable decision, you definitely want to make sure that you're checking with your coverage for your insurance so that you know what's covered and what's not. So some hospitals might be in an area where there's a protection from weight discrimination, but that might be outside of your plan, which would make a potentially devastating financial difference to you. So there are many things to consider, one of which is the existence of laws prohibiting weight discrimination, but that's just one of many factors to consider.
Thank you. And this is Susan.
And also, obviously, you have to consider your own safety and timing. So, if I use myself as an example, if I'm in Berkeley and my insurance covers hospitals in San Francisco, I may want to go there, but if I'm in a dire emergency, I may choose the closest hospital, figuring that I'll fight the battle of weight discrimination as best I can, but I need to get into a hospital first. So there's a lot of factors to consider. We definitely suggest considering all of those carefully, ideally in advance, so that you're not trying to figure that out when the emergency happens.
Okay, so, and we're getting close to the end. I should have mentioned that we've scheduled this until 1:45. We may be able to go over a few minutes. Here's a pretty good question that's come up. What can we do before we end up in a tough spot to secure our healthcare rights in a crisis? That is to say, is there a way to approach our local hospitals, urgent care, police, other first responders, etc., with information and support that puts us, disabled, fat, trans folks, in the roles of helpful and useful resources in how to do their jobs better, rather than as last-minute hassles in the ER? Are there materials or approaches or organizations that we can befriend that will allow us to help educate and train these folks to be equitable and ethical, to understand accommodations and unique needs, so that when the time comes, as it will for many of us, that we get this virus, the medical support systems around us are already doing better and are in a position to help us get well? So how can we be proactive in making sure treatment response and treatment is already ready for people with disabilities, fat people, and transgender people?
This is Claudia. I think what we're all doing is everything today during this meeting is examples of trying to prevent a crisis in the ER or in the hospital unit, which is trying to educate people about their rights, asking questions. We're going to follow up on some questions, being connected to DREDF, to TILDEF, to Nobody is Disposable. There's a lot of good suggestions in the chat box about, reaching out to hospital ethics committees, if that's, that's a big project, but that would be cool. Getting these stories in social media, getting them in the news, raising the problem of discrimination in healthcare rationing. I'd also like to underscore that so far in this country, we don't really have reported cases of people being denied care based on disability because the devices went to other people. Now, I'm not saying that hasn't happened. I'm just saying that a lot of what we're doing is to prevent that from happening. I think we've made some progress in both slowing down the virus's spread and in preventing the kind of rationing that other countries reported as an ordinary course of, of how things went.
I'd like to add, this is Sandra.
Oh. No, go ahead, Sandra.
Thanks. I'd like to add that the open letter to the medical community that we're working on is a big part of that. So one thing that's really important is not to see ourselves in opposition to folks who are providing care. This is a joint effort. This is a community effort. So understanding that having adequate equipment, whether it's personal protective equipment or adequate ventilators, like that's first line of defense, because it'll prevent the need to implement these kinds of protocols. It'll just bypass that entirely. And then the second thing, I agree with everything that Claudia said. We are actively reaching out to ethics committees and being in conversation with people, and then doing all kinds of educating. The fat community and the disabled community and trans community all have been working with care providers, educating people at medical graduations, for example, about the needs of the community. So I really think it's about being proactive and educating. And definitely, if you're interested, please contact us because we're working on that.
And this is David. I just wanted to add that I think your question also highlights the need for a long-term approach, right? That when people make decisions about who to vote for, or the kinds of political activities that they want to engage in, where they want their tax dollars to be spent, and where they want to, who they want to give, donations to, and things like that. When making those decisions, it's all really important to remember that laws and policies that foment a culture of non-discrimination and a culture of public health and a culture of universal access to healthcare coverage, will prevent these kinds of crises from happening again and from being as bad in the future. And so ensuring that your elected officials and your policymakers are thinking about, how do we have robust non-discrimination laws and policies in place so that our healthcare providers are hearing from the community, are engaging with organizations like ours and others, and are prepared to ensure that discrimination doesn't happen in the future, is a really important piece of that answer. And it may not change anything overnight, and it may not even help in the short term with the COVID crisis, but it'll help in the long term, and it'll help make the next crisis, which invariably there will be one, that much easier to address and overcome.
Thank you, David. I want to slip one more question in before we break up. There's somebody asked that said they have the beginnings of paralysis due to a spinal cord issue and was told that they needed urgent surgery to prevent the paralysis from progressing. They've been told that where they live, hospitals are only allowing critical life or death in the moment surgery. As time passes, the condition progresses. Is there anything the person can do to get the surgery done before the paralysis worsens? Or are they simply stuck waiting?
This is Claudia. I don't have an exact answer, but it sounds like that is very necessary surgery that should not be postponed. I don't know if you could contact your local protection advocacy agency. That is usually called Disability Rights and then the name of your state. And if you have, you can Google them, Disability Rights, name of your state, and call them and see if they have any suggestions. And also, just keep calling people in the different bureaucracies and go up the chain and just try and advocate. I hope other people have more suggestions.
This is David. AC mentioned in their presentation that most hospitals have an office of an ombudsperson or something like that, and that's another person you can ask within the institution. I've been told that my needs are urgent, my process is progressing, but it seems like my care team has made the decision that this falls under non-critical, and I disagree, and I'd like a second opinion. That may be another route to go.
Thanks. So, excuse me. So this is Susan, and we have to start wrapping up. I just wanted to say that I've been watching the chat and the question and answer, and that you all are providing mutual support in those two forums, and we really appreciate it. We've been asked many times, is this being recorded? And yes, we recorded the webinar. Once we make sure the captions are accurate, we'll be posting it to our websites, and we'll send out an alert to everybody that it's there. We will also be sending out, and we can post the transcript also separately. We will be sending out a document that has links to all of the resources that have been mentioned. And you can always, AC and David and Brandy and Sandra and Claudia and the respective organizations for more assistance. This has been incredible. AC and David, thank you. And the transgender legal, it's so funny because your name is like DREDFs and it's hard for me to remember how to say it. Transgender Legal Defense and Education Fund. And to Sandra and Brandy for your advocacy and your work. And Claudia, thank you. And also to Rick, our interpreter, and Deanna, our captioner, for doing this work. I'm sorry for the technical glitches at the beginning. I hope everybody was able to access both the ASL and the closed captioning as needed. The questions that we didn't get to, there are only a few in the Q&A. We will respond to them in some manner. So watch your email for those also. Anyway, I think we're ready to wrap up. I really, really appreciate everybody coming. Everybody appreciates that. Why don't you panelists all take off your mute and say goodbye before we end.
Bye. Goodbye.
Thanks, everyone.
Bye. Thank you, everyone.
Thanks all.